Welcome to Internationally Qualified Nurses Licensing Exam. Let's continue learning and expanding your knowledge on medication safety. In addition to dosage calculation, you can expect 2 to 3 questions related to action of the drug or mechanism or maybe the side effects of that drug or what are the special considerations related to that specific drug. In today's session, I have included questions related to commonly asked drug. This will be helpful not only in Part A medication safety but also in nursing knowledge Part B. Let's explore them in detail. Let's focus on crash cart medications and their mechanism of action, as this knowledge is essential for both health education and understanding their clinical effects. Let's see by one. Epinephrine, also known as adrenaline. It's a vasoconstrictor, that means it tightens the blood vessels by increasing the heart rate and blood pressure to restart the heart. And it is used in cardiac arrest as well as in anaphylactic shock or any kind of allergic reaction. Noradrenaline, otherwise known as norepinephrine, and its use is it acts as a vasopressor, and it is used in cardiac arrest or if the patient is having low blood pressure, especially in the shock. It improves the blood flow to the vital organs by increasing the BP. Atropine, it has an anticholinergic effect by increasing the heart rate by blocking the vagus nerve effect, that is used especially in symptomatic bradycardia, that means very slow heart rate. Amiodarone, it's an antiarrhythmic drug. It is used in life-threatening irregular heart rhythms like ventricular fibrillation or ventricular tachycardia. It restores the normal heart rhythm. Sodium bicarbonate, and it is used especially to correct the metabolic acidosis when our body becomes too acidic, commonly in prolonged arrest, and it balances the pH level in the blood. About this calcium chloride, it is especially used to stabilize the heart muscles and restore the rhythm. And if the patient is having this hyperkalemia, hypotassium level or calcium channel blocker overdose, or in cardiac arrest, we are giving this calcium chloride. Magnesium sulfate, it's a CNS depressant and it has antiarrhythmic effect, and it helps to use in stabilizing heart rhythm and managing seizures as well as. Ectomidate, propofol and ketamine, these are collectively called as induction agents, that means it is used before intubation, and it's especially they are using in rapid sequence intubation. In emergency situation, we are giving this kind of patients to sedate the patient quickly and keeps the BP stable during intubation. Vasopressin, it is a hormone with vasoconstrictor effect. It is used in cardiac arrest, and it is used with epinephrine to improve the circulation during CPR. As you all know, naloxone, it reverses the opioid overdose. It is an opioid antagonist, means it blocks the opioid receptor and quickly reverses the effect like respiratory depression. Okay, adenosine, it treats the rapid heart rhythms like SVT, supraventricular tachycardia, and monomorphic ventricular tachycardia in order to reduce the heart rate. That means it slows the electrical conduction through the heart by helping them to restore a normal rhythm. And dextrose we are giving for this hypoglycemic patient. It provides a quick source of glucose in order to raise the blood sugar level, especially in unconscious or unresponsive diabetic patients. We are giving dextrose. Lidocaine acts as a local anesthetic and also treats this ventricular arrhythmias, and by stabilizing the heart's electrical activity by blocking sodium channels. Dopamine, it is used to increase the blood pressure, especially in shock or the patient is having severe hypotension. And about this nitroglycerin, it acts as a vasodilator, and it relaxes and widens the blood vessels by improving the blood flow and reducing the chest pain, especially in angina. Unstable angina, we are giving nitroglycerin in order to relax and widens the blood vessels. Diazepam, also called as Valium, it treats the seizures and it used for anxiety, to reduce the anxiety and in conditions like the muscle spasm. Vecronium, it acts as a muscle relaxant and it is used during intubation or surgery. Let's review some cardiac drugs. Nitrates typically is used to treat angina, especially the chest pain, in order to dilate the blood vessels and improving the blood flow to the heart. We are using this nitroglycerin. So major side effects which we can see for that drug is hypotension, headache and flushing of the skin, especially on the face. In order to prevent blood clots, we are preferring for this antiplatelets, especially aspirin and clopidogrel. And the major side effect for this is bleeding as well as GI irritation. ACE inhibitors always help to open up the blood vessels, like enalapril, lisinopril. They helps to relax the blood vessels and lower the blood pressure. And the major side effects which we can see is hypotension, along with dry cough, commonly with ACE inhibitors. And for some, it may leads to hyperkalemia, that is increased potassium level. For those, in order to relax the blood vessels and reduce the heart's workload, we are giving calcium channel blockers as well as beta channel blockers. In order to slow down the heart rate and reduce the heart's workload, metoprolol and ethanol we are giving for the patient. These two are the common one. And it may produce bronchospasm, especially in asthmatic patients. You should be cautious. And it slows the heart rate, it will end up in bradycardia. For calcium channel blockers, their side effects are it may interrupt the gastric motility and it will end up in constipation. Anticoagulants or thrombolytics are used to treat blood clots and always used in conditions like atrial fibrillation, DVTs, and for pulmonary embolisms we are giving anticoagulants or thrombolytic agents like warfarin, heparin and enoxaparin. And you have to inform the patient for bleeding, and it requires constant INR monitoring, especially with warfarin. And statin we are giving in order to reduce the cholesterol level, and it prevents the cardiovascular diseases, especially atorvastatin, simvastatin. Usually it should be preferable at night. And the major side effect which we can see is muscle pain. And digoxin we are giving to strengthen the heart contraction and controls the heart rate, especially in AF and or in heart failure. The major side effects which we can see is bradycardia, visual changes, and if the level are too high, that is digoxin level is exceeded the normal therapeutic range, that is from 0.5 to 2 nanogram per ml. If it is exceed, then it leads to toxicity. Here regarding this bronchodilators, which are medicines that help open up the airways in your lungs to make breathing easier. First of all, we will see salbutamol. This drug is used for asthma, chronic obstructive pulmonary disease, and those who are having this tightening of airway muscles. And side effects which we can see is tremors, that is shaky hands, feeling like your heart is racing, and fast heartbeat. This is a short-acting beta agonist that works quickly. And about this aminophylline and theophylline, if when the other treatments doesn't work well, especially for severe asthma and COPD, we will recommend this aminophylline and theophylline. And major side effects are arrhythmias like irregular heartbeat, and in high dose or toxic level it will end up in seizures. With regard to this drug, fluticasone and budesonide used for cold and asthma patients. This can cause oral thrush, a fungal infection in the mouth. Along with, you can see a change in the voice like a hoarseness. These are the major side effects. These are steroids used to reduce the inflammation. Patients should rinse their mouth after using these to avoid side effects. Okay. After taking these all medications, you have to instruct how to use this proper inhaler technique to ensure the proper drug delivery, and always ensure that rinse their mouth after using this steroid inhaler in order to prevent oral candidiasis, and always monitor the heart rate in patients using theophylline. And here the diuretics, which are the medications used to remove excess salt and water from the body by increasing their urine production. Okay, so here we can see loop diuretics, for example furosemide. So how to work this is, this will work to promote the excretion of sodium chloride and water, and especially these are used commonly for heart failure or kidney disease patients. So what are the major side effects we can expect for such kind of diuretics? They can cause hypokalemia, that is low potassium level, bradycardia, slow heart rate, and low blood pressure. Along with, for some kind of patients may come up with ototoxicity, that is damage to the ear leading to hearing loss. Okay, next is thiazide diuretics, commonly used as hydrochlorothiazide. Here they may lead to hypokalemia and hyponatremia, that is low sodium level. And if you are giving this potassium sparing diuretics, that commonly used for spironolactone, they can cause hyperkalemia, that is high potassium level, and for some development of breast tissues, especially in men, that is gynecomastia. So these are the major side effects. With regard to this osmotic diuretics, for example mannitol, as you all know that mannitol is mainly used for acute conditions like brain swelling or glaucoma. So this can cause dehydration and electrolyte imbalance due to rapid fluid loss. So diuretics are very effective in managing this fluid overload, but their use requires careful monitoring due to potential for significant electrolyte imbalance. So as I told you, here in the keynotes I mentioned that always monitor the electrolytes, especially potassium and sodium level, and teach the signs of hypoglycemia, especially this muscle cramp along with fatigue the person may show, and closely monitor the vital signs including the BP and daily weight of the patient. And please inform your client to take this diuretics in the morning in order to avoid this nocturia. In case of spironolactone, avoid potassium rich foods. You can instruct those who are taking mannitol monitor for signs of fluid overload, and those who are taking this furosemide, as we already mentioned, it may produce this hearing loss, and assess for ototoxicity in high dose of furosemide. So these are the key notes you have to keep in mind. This will be helpful to give health education to those patients. Let's see few psychiatric drugs that you should familiar with. I will start by seeing this antidepressants. I mentioned that fluoxetine, sertraline and citalopram. These are the selective serotonin reuptake inhibitors that can cause, or their side effects are, they can cause seizure disorders, especially seizure disorders, and citalopram, they may produce this GI disturbance like nausea, vomiting, and along with that the patient may have this dizziness, headache and dry mouth. About this mood stabilizer lithium, its normal therapeutic level is 0.5 to 1.5 millimole per liter. This is not suitable for patients with renal disease, and it can cause tremor, nausea, vomiting, dehydration and anhedonia, that is loss of pleasure. So these are the few side effects if you are using this lithium above the therapeutic level. Then with regards to this antipsychotic, it again classified as typical and atypical. So typical antipsychotics are haloperidol, clopramazepine. This can cause, or this may have this side effect of severe CNS depression. So it can leads to central nervous system depression. And if you are using this antipsychotic, that is atypical antipsychotic drugs, they are risperidone, olanzapine and quetiapine. Weight gain is clearly evident for this kind of antipsychotic drugs. Along with the patient may have this dizziness, unusual body movements like possibly like extrapyramidal symptoms, along with tachycardia. And anxiolytics, benzodiazepam, lorazepam, alprazolam, they may produce respiratory depression and especially dangerous in overdose or with alcohol, and they may produce severe liver damage. The stimulant like methamphetamine, as while hearing itself, it's a stimulant itself, so it's nowadays rarely used in medical field now, as they have high potential for this addiction and abuse, and it may produce liver damage. And moving further, you can see anti-epileptics, that is a mood stabilizers, especially sodium valproate, carbamazepine. These are the common drugs, and it is used for epilepsy and to stabilize mood in bipolar disorders. And major side effects are euphoria, that is exaggerated happiness. Those who are taking this medication, they may have this high energy level, rapid speech, paranoia and liver disease. So you have to make sure that you have gone through these psychiatric drugs. Always keep in mind that monitor the labs for lithium level as well as valproate level, as it may produce severe impact in renal, liver function and sodium level. So keep in mind that always monitor if we are giving this lithium or sodium valproate for this patients. And try to avoid this abrupt withdrawal or sudden withdrawal, as it most psychiatric drug may tapering of this drug. You should never stop the drug abruptly or suddenly. Educate the patients on side effect, especially for these extrapyramidal symptoms, especially for typical antipsychotics. They may produce extrapyramidal symptoms like acute dystonia, that is sudden painful muscle spasm, ekasthesia, that is inability to stay still, that the patient cannot able to stay still. They may produce some kind of actions, the involuntary movements. And about this dyskinesia, that is involuntary movements. So these are the three extrapyramidal symptoms, especially for typical antipsychotics. Let's see some anti-tuberculosis drug. These are the drug which we are giving for the patients, especially rifampicin. It is a powerful antibiotic, as you all know, and it is commonly used to treat tuberculosis and other bacterial infection as well, and often in combination with other drugs like isoniazid, pyrazinamide and ethambutol. And for the major side effects which we can see is orange red discoloration of the body fluids like urine, sweat, saliva, tears. It is harmless but alarming to the patient. Isoniazid, it's another drug for tuberculosis treatment. It mainly produces some kind of side effects like peripheral neuropathy, that is tingling or numbness in the hands as well as in the feet, and it may produce hepatotoxicity. And you have to watch for jaundice or elevated liver enzymes, and also you have to check for any rash along with fever for that kind of patients. And pyrazinamide, that is another tuberculosis drug that will come up with hepatotoxicity and hyperuremia, that is high uric acid level that can leads to joint pain, and that is arthralgia. And along with that, for some it may come up with GI disturbance like nausea, vomiting. And Ethambutol, it's another tuberculosis drug. It may produce some kind of eye issues, that is optic neuritis, that is inflammation of the optic nerve, and it will end up in the, let's see, sexually transmitted disease drugs, the medications, what we are using for, and what are the common side effects. And we will see one by one. The first one is chlamydia. The drug we are offering for that kind of disease, that is azithromycin as well as doxycycline. The major side effect for those drugs is GI upset, that is nausea along with diarrhea, and also for some may come up with photosensitivity, that especially sensitivity to sunlight. And for gonorrhea, we are giving the ceftriaxone along with azithromycin and doxycycline combination also usually we will give to your patient, and it will produce this GI disturbance. For syphilis, we are giving benzathine penicillin given intramuscularly, and major side effects are allergy. Especially important to ask about any penicillin allergy for those kind of patients. And herpes simplex virus, and they are treating with acyclovir, and it may produce nausea, headache, and renal toxicity. Hepatitis B usually transmitted to sexual activity, and we are providing tenofovir, and it may produce GI upset, liver. Important clinical advice you can offer for those patients: ask about allergies. Always ask about the allergies, especially for penicillin. And advise the patients about complete abstinence during the treatment. And always practice safe sex practices to prevent further transmission of the disease. We will end up by seeing certain anticoagulant medications, their antidotes and major side effects. The first one is heparin. It can use intravenously or in the sub-Q form. The antidote for this medication is protamine sulfate, and the side effects which we can see is bleeding, thrombocytopenia, that is low platelet count. These are the side effects for using this heparin. And if we are giving this warfarin orally, vitamin K antagonist is the antidote for that, and the side effects we can expect, that is bleeding. Another oral anticoagulant, that is dabigatran, that may produce bleeding or any kind of GI upset. Enoxaparin or Clexane, that is a low molecular weight heparin that also have side effects of getting bleeding and pain at the injection site. And always inform your patients, like avoid NSAIDs and alcohol in conjunction with anticoagulants, and watch for signs of bleeding gums, urine, stool, and any bruising in the body. We have now covered nearly all the important drugs related for your exam. Before the exam, make sure to quickly review these. Doing so will be very helpful for your preparation.